you.
All right, we're on to the report of the city manager. Welcome, Jennifer.
Yes, thank you. Good afternoon, Mayor and City Council. Have two updates today. The first is on our sewer coronavirus alert network, and then we'll have a more in-depth update on our COVID-19 efforts as we've been doing monthly. So I'll start it off, and then I'll turn it over to Kip Harkness to kick off on the more in-depth COVID-19 update. As many in our community may not be aware, the San Jose Santa Clara Regional Wastewater Facility, Stanford University, and the County of Santa Clara have been engaged in an innovative partnership to help health officials track the spread of COVID-19 and improve the county's public health response to the coronavirus. The Regional Wastewater Facility, the largest advanced wastewater treatment facility in the Western United States, is co-owned by the cities of San Jose and Santa Clara and operated by our own Environmental Services Department. Staff of the Regional Wastewater Facility collect daily samples of wastewater known as settled solids and provide them to scientists who analyze the samples looking for genetic markers of COVID-19. This method enables health officials to track coronavirus trends and forecast dips or spikes in coronavirus infections coming in 7 to 10 days. Not dependent on testing people, this methodology of sampling wastewater provides a unique and forward-looking way to predict and plan for COVID-19 behavior. Based at Stanford, which first tested the method at the Regional Wastewater Facility in 2020, the project is called the Sewer Coronavirus Alert Network, otherwise known as SCAN, and now includes scientists from the University of Michigan and Emory University, 11 cities in California, and the life sciences research company Verily. The collaboration between the Regional Wastewater Facility, Stanford, and the county has been featured in several recent news stories, including reports on NBC Bay Area and MSNBC this past weekend. I would like to thank city staff for their contributions to this groundbreaking project that protects public health in the South Bay, including the staff at our San Jose Environmental Services Laboratory, Pael Sakar, Casey Fitzgerald, Noel Inoki, and the entire lab team, and the Regional Wastewater Facility employees, including Amit Mutsetti and the Operations and Maintenance team. I also want to thank our partners at Stanford University and Santa Clara County for their collaboration on this important project. Lastly, I'd like to acknowledge Michael Ballier, Director of the Santa Clara County Department of Environmental Health, for his leadership on this project. And with that, I'm going to turn it over to Kip to start us off on a COVID-19 update.
Thank you, Jennifer. Good afternoon, Mayor, Council, members of the public. I'm Kip Harkness, Director of the Emergency Operations Center. The EOC team last updated you in person on the 30th of November, 2021, and by memo on the 18th of January, 2022. It was exactly 2 years ago yesterday that we initiated our pandemic response and began to prepare for what was then called the novel coronavirus, first identified in Wuhan, China. Next slide. Today, we come to you with 2 years of experience in responding to this pandemic. In this update, the team will provide City Council and public highlights of 9 key areas of our emergency response to COVID-19 as we are dealing with the most recent surge caused by the Omicron variant. The variant is proving to be the most transmissible yet, though for those who are vaccinated and boosted, not as deadly as previous waves. We'll begin the update with a look at the science and data of the latest surge presented by Dolan Beckel, the Assistant Director of the Emergency Operations Center. Dolan?
Thanks, Kip. Good afternoon, Honorable Mayor, Council members, members of the public, and City staff. Dolan Beckel, Emergency Operations Center Assistant Director and Operations Chief, here to provide an update on recent trends in COVID-19. Omicron has become the dominant COVID-19 variant worldwide, including here in the United States. It is 3 to 5 times more transmissible, and the replication speed is 70 times faster than that of the Delta variant. Thus, the national level of transmission is once again back to red or high, while the number of infections and deaths are reaching pandemic highs due to the volumes associated with this high transmissibility. Overall, most people are experiencing generally mild symptoms. Full vaccination plus booster provides a very high initial degree of protection against Omicron. Research indicates the duration of the Omicron surge will be approximately 6 to 8 weeks, 3 to 4 weeks up and 3 to 4 weeks back down. Policies and public outreach strategies around the multiple layers of protection beyond vaccination and boosters, such as masking, testing, distancing, and medical treatments are evolving rapidly. In addition to the vaccines and boosters, the Federal Food and Drug Administration, FDA, has recently authorized 2 oral antiviral treatment pills for individuals affected by COVID-19. Due to Omicron's transmissibility, the county 7-day rolling average of new cases has increased 26-fold since our last report. The relative good news here is that cases peaked on January 5th at 6,552 cases and are trending downward rapidly. Daily case reports are running approximately 50% of the January 5th peak. Total deaths have unfortunately increased 4% since our last report, averaging about 8 deaths per week. This relatively low and stable trend for COVID-19 deaths and case rates is directly related to the city and county high vaccination percentages and relatively high booster percentages, and shows the effectiveness of the vaccines and boosters in dramatically reducing major illness and death from COVID. While the symptoms are generally mild, the heightened transmissibility of Omicron places the number of patients at hospitals in the county at a near pandemic high. Hospitals are under pressure for many reasons, including volumes of patients, constrained supply of staff, and staff unavailable due to isolation and quarantine. Intensive care or ICU bed ventilator availability is under slightly less pressure. The Santa Clara County Health Officer has issued recommendations to help reduce the pressure on the hospital systems, including recommendations on where, how, and when to get tested. The good news is these pressures are expected to be relatively short-term as the cases decrease over the next few weeks. 4 days after the peak in cases, the quantity of COVID-19 in San Jose's wastewater had also peaked and is trending downwards. This is what City Manager Jennifer Maguire just talked about. Previous analysis has shown that the downward trend should continue, but it will also be, as the experts say, bumpy, so expect some variation in coming days and weeks. I'll now turn the presentation over to Alvin Galang to provide an update on vaccinations and boosters, including some breakthroughs with the county on data. And with that spoiler, I will turn it over to Alvin Galang. Alvin?
Great, thank you, Dolan. Good afternoon, Honorable Mayor, City Council members, and members of the public. My name is Alvin Galang, Vaccination Task Force Director. Thank you for allowing me the opportunity to present on the ongoing work, challenges, and accomplishments of the City of San Jose's Vaccination Task Force. What has changed? As you will see over the next few slides, the City of San Jose's completed vaccination rates continue to increase. However, as Dolan mentioned earlier, the number of COVID-19 cases has also increased along with hospitalizations. But the better news is that COVID-19 deaths have remained low and steady. What is driving the change? Since January 5th, even more of our kiddos are now eligible to receive a booster shot. This is about 7 months after they received emergency use authorization for their primary series. You will also notice that the common change agent throughout this presentation will be the Omicron variant. And we are about a month since the holidays. Last year during the holiday season, the peak of the surge occurred between early December and early January. Our current surge began in mid-December. So again, as Dolan pointed out earlier, it appears that we will continue to trend in the right direction. What is new? The highly transmissible Omicron variant, primarily responsible for the spike in cases, where in Santa Clara County, the case rate among the unvaccinated is over 5 times higher than those that are fully vaccinated. The City of San Jose's Vaccination Task Force is supporting the county by continuing to provide use of its facilities when needed, particularly filling any gaps that might occur with pediatric vaccination sites. We've also maintained our relationships with the county public health communications team and will continue to focus our communications and outreach to our under-resourced communities. And the Vaccination Task Force is also taking care of the City of San Jose's workforce as we've scheduled 3 employee booster clinics that will occur over the next several weeks. Next slide, please. These are the numbers that we have been tracking over the past several months. As you'll notice, among City of San Jose residents ages 12 and over, we have a nearly 93% completed vaccination rate. In Santa Clara County, among the total population, 79% of residents are fully vaccinated. So overall, vaccination rates continue to rise regardless of the metric. However, through our continued partnership with the county, we have been able to secure more specific numbers for the City of San Jose, which I will cover later in this presentation. Next slide, please. The numbers that you see here represent vaccination rates among all ages. On the left are the countywide vaccination rates by race and ethnicity for all ages. During our update last November, we presented the data that was available at the time, which accounted for those age 5 and over. On the right are numbers that are specific to the City of San Jose. Similarly, our November presentation reflected the city's completed vaccination rate among 12 and over. We are now presenting the data as completed vaccinations among all ages. Since November, the Vaccination Task Force has supported the county and other partner providers to deliver over 5,500 vaccinations, with a large portion of the city-county partnership has come from the successful vaccination clinic at Emma Prush Farm and Park. And we continue to utilize our digital tools and resources and have generated an additional 567,000 impressions since our previous update. Next slide, please. These are the 13 current census tracts within the City of San Jose that have lower vaccination rates of less than 75%. The task force will continue to focus outreach and communication within these tracts, and whenever possible and as requested, assist with the coordination of mobile vaccination clinics to serve these neighborhoods. Next slide, please. Now, this slide illustrates the city's vaccination task force continued relationship with the Santa Clara County Public Health Department. With the support of the county's science branch team, we are pleased to present the latest vaccination rates, disaggregated by age and ethnicity, and equally important, specific to the City of San Jose. This was a direct request from Councilmember Carrasco, as well as others on the council, and although it is a snapshot in time, the numbers and colors speak for themselves. The efforts of the Vaccination Task Force and its partners have paid off. Together, we've made great strides in protecting the community. Next slide, please. In addition to more disaggregated City of San Jose specific data, we are pleased to share with the council that the Vaccination Task Force has also partnered with the city's Department of Public Works spatial team, and we've developed an interactive dashboard that will allow you to click on your neighborhoods and view detailed information on vaccination rates, COVID-19 cases, and other demographic information. Again, this is also a work in progress, but we will connect with the council offices offline so that you all have a chance to explore this new tool. Next slide, please. With pediatric vaccinations, the City of San Jose continues to support the county in ensuring higher vaccination rates among our younger folks, especially in our under-resourced communities. We will continue to focus on communications and outreach strategies, which will be covered more in depth by our communications director, Carolina Camarena. We will also, when needed, do our best to provide city facilities as vaccination sites whenever there may be any scheduling or logistical challenges at the schools. As you will recall, since November 3rd, vaccination eligibility was expanded to include youth ages 5 to 11. In almost 3 months' time, over 40% of those youth in San Jose have completed their vaccinations. And our communities continue to receive most of their vaccinations through the County of Santa Clara, including the County Health and Hospital System and mobile vaccination clinics at schools and community locations, through the pharmacies, including Safeway, Walgreens, Rite Aid, and CVS, and also through Kaiser Permanente. Next slide, please. And Mayor Liccardo, I know this is usually your favorite part of our update, but San Jose remains the most vaccinated city within the top 10 largest cities in the United States. So with that, I will now turn the presentation over to Carolina Camarena.
Thank you, Alvin. Good afternoon, Mayor, members of the council, members of the public, and my colleagues. I'm Carolina Camarena, Director of Communications, and I'm going to focus on communications and outreach. The first few slides are going to be a recap of the tactics we have employed or are underway. We delivered 151,000 postcards in 4 languages with vaccination and rental assistance information to our priority census tracts. Partnerships and working with community organizations have been essential to ensuring we reach our most vulnerable. We worked through our San Jose Public Library to distribute 66,000 flyers about the 5+ vaccine eligibility to San Jose elementary schools. Equally important to us is listening and learning from you and your community needs. In a previous meeting, you asked about incentives for 5+ vaccinations. Well, we partnered with the Children's Discovery Museum to promote vaccinations with 200 passes. Making sure our messages resonate is paramount to everything we do in communications, and we heard this from you as well. So we developed a youth survey to help gauge what messages would best resonate with this audience, and the youth responded. We received over 176 replies, and they want to be a lifesaver. Get vaccinated to help protect the lives of your family and community. Next slide, please. We continue to develop and share organic social media with multilingual content weekly, including creating in-house campaigns that support the county messaging. As you can see, COVID-19 related posts on average have more impressions than any other social media posts, with Facebook and Instagram seeing a 130% increase and Twitter a 20% increase. Next slide, please. A little on our social media influencer campaign. We implemented the campaign to amplify crucial vaccine site and safety information through trusted and well-known messengers. We know that youth are highly active on social media and look to local celebrities for information. The campaign was a success. It surpassed our 1.4 million impressions, and we had 21,000 engagements by users. Since our priority audience remains largely the same, we are looking into another social media influencer campaign. I know some of you had suggestions on a variety of influencers in the area. We welcome your suggestions and connections to those social media influencers. Radio remains one of the best ways to reach our non-English speakers. We are focused on 3 different radio stations to reach our diverse Spanish-speaking community, including youth and those who have agency over the age of 5. Between the 3 stations, we ran more than 500 radio spots with over 1 million impressions. Oftentimes, I am asked how we know our tactics are successful. There are 2 ways to measure communications and outreach. We've got quantitative and qualitative data. The quantitative data, impressions, engagements, CTRs, or click-through rates is telling, but the real measure is our qualitative data. Bottom line, how many shots in arms do we have? Mayor Liccardo, we remain the highest vaccinated large city in the nation. Now, I am passing this on to Matt Opso, who will share some very telling data on reaching our non-English speakers. Matt?
Thank you, Carolina. Good afternoon, Honorable Mayor, council members, city staff, and the public. My name is Matt Opsel. I'm a Senior Executive Analyst in the City Manager's Office of Communications, focused on website administration and digital technologies. On this slide, we have analytics from July to December 2021, focused on emergency outreach and flash reports. The emergency notification pages, available in English, Spanish, Vietnamese, and Chinese, received 185,000 visits, with 47,000 of the visits going to the translated pages. It is worth noting that 64% of the Virtual Local Assistance Center, or VLAC, traffic went to the COVID-19 vaccines page. We sent out 27 flash reports during this time frame. The 379,000 flash report emails had an average open rate of 36%, which is 11% higher than government industry standard. We also saw an email subscriber increase of 3%. Next slide, please. In the second half of 2021, We utilized the Wireless Emergency Alert, or WEA, system to send out targeted text messages to residents within specific census tracts to notify them of vaccination sites and vaccination events in their areas. The chart on this slide illustrates the year-over-year traffic handled by the emergency notification pages. In 2021, traffic for the Spanish emergency notification page went up 107% due to the WEAs. Next slide, please. For this final analytics slide, we have a year-over-year chart to visually showcase the growth in 2021 based on visits to the VLAC pages. The VLAC web pages provide information to the community in a virtual space in lieu of in-person information sharing at community centers. The VLAC web pages contain updated and evergreen resources for food, housing, employment, families, immigration, utilities, health and wellness, and COVID-19 vaccines. In 2021, the visits to the VLAC pages have increased by 45%, with strong growth noted in the previous slide to the COVID-19 vaccines page. The COVID-19 vaccines page is updated weekly with information linked to the county, state, and federal government for your use and for our community's use. Next slide, please, and back to you, Carolina.
Thank you, Matt. So in summary, we continue to meet with the county's communications team to align on audience and messages. Our focus remains on vulnerable residents and our non-English speaking communities. We work hand in hand with the city's vaccination task force to identify census tracts with low vaccination rates. We determine key messages that are relevant for the moment and into the future. Currently, our messages remain consistent due to the Delta and the highly transmissible Omicron variants. We know that a variety of tactics are necessary to reach our diverse population. We continue to evaluate our strategy and tactics through analytics, from lessons learned, collaboration with our partners, researching best practices, social listening, and keeping our pulse on our communities. Currently, we are working with the county's Office of Education on a coloring sheet that will be distributed to San Jose elementary schools, and we will have some on hand for you to distribute as well. The idea is to provide tips to those who have agency over children so they can ensure children are less fearful of a shot. We are reaching out to community-based organizations, faith-based organizations, neighborhood associations, local farmacias, and alternative medicine locations in the communities most affected with flyers they can share with their customers. We have a direct mail piece underway focused on vaccinations, boosters, preventative measures, and the digital resources available from our San Jose Public Library. We are advertising on radio, and digitally on Google, Spotify, and Facebook. I'm always happy to hear your feedback and suggestions. And now, I'll turn the presentation over to Jennifer Shembry.
Good afternoon, Jennifer Shembry, Director of Employee Relations and Human Resources. And I'm here to give you an update on hybrid work facilities and resources. So due to Omicron and the increased cases, we did delay returning additional employees to the work site until February 11th, and also encouraged anybody else who can work from home to do so with a plan to revisit that every 2 weeks. The City Council did approve an employee booster mandate, which has been announced to all city employees with the deadline date of February 11th. And we do have various employee booster clinics scheduled between now and then. We are working on refreshing our employee masking guidelines, which will hopefully go out sometime this week. And there was an approved city-owned facility event ordinance modified to require booster or testing effective February 4th. We have also secured a pipeline of rapid antigen tests for employees and did receive a shipment of those this week. We are focused on providing those for our employees with medical and religious exemptions, and where we have employees quarantined or positive who could return to work sooner with a negative test. We have, as I mentioned, scheduled the 3 supplemental booster clinics for employees and approved 100% virtual council meetings through January 25th, subject to further changes by the Rules and Government Rules Committee. We have moved the EOC activation up from level 4 to level 3 monitoring as the Omicron variant continues to impact our area. We'll pass that on to the small business recovery.
Good afternoon, Nancy. Office of Economic Development and Cultural Affairs. Just wanted to briefly share a little bit about the small business recovery during the pandemic. Throughout the whole period, OEDCA has focused almost exclusively on those small businesses who are most vulnerable in the areas that have been hardest hit. And there are many, many lessons learned, some of which you see on the slide, but chief among them is the importance of working with our small business community and the nonprofit community, because they are closest to their communities and know needs and concerns the best. So working to get additional resource or supplemental resource has done very well and will be a strategy as we move forward out of recovery. There are many things that are going on now. You see several on the right-hand side of the screen. I'll just mention a couple of them. OED has 2 new bilingual staff, and we will be working to add 1 more. So we have great skills in both Spanish and Vietnamese translation. We are working to bring the small business displacement policy back to council. That will happen, is targeted to occur in September. Kettle Gardens, the soft launch for the housing project that also has resident home for Somos Mayfair and an innovative small business incubator, will have a soft launch in April with a big splash to open in June. With that, I just want to also mention that by April, we'll have applications on the street for $2.75 million in small business grants, additional grants for our small business communities, particularly those in the most affected areas. Thank you very much.
Good afternoon, Sarah Sarate, Director of the Office of Administration, Policy and Intergovernmental Relations. A lot has occurred at both the state and federal level in response to Omicron impacts. From a funding perspective, California received an additional $62 million for rental assistance, short of the larger requests made by the state, but certainly bringing some relief. Requests for additional funding are ongoing. The state also funded over $5 million of utility arrearages, and the governor requested an additional $2.7 billion for COVID response as part of his budget blueprint, including a $1.4 billion emergency appropriation request to support testing, vaccination, and boosters efforts, among other things. And today, the governor and top state legislators announced they reached agreement on a framework to ensure employees continue to have access to COVID supplemental pay to leave through September 30th, an issue we know is important to this council. Earlier this month, the governor also signed an executive order extending public agencies' ability to meet remotely through March 31st of this year. And he also activated the National Guard to bolster the state's testing capacity. On the federal side, today, President Biden withdrew his requirement that large employers mandate workers be vaccinated or regularly tested. This follows the Supreme Court blocking enforcement of that rule, but allowing some requirements from certain healthcare facilities. Biden also announced this month new guidelines requiring that private insurers cover the monthly cost of 8 at-home COVID tests per member, as well as rolling out a new free program that mails COVID-19 tests directly to homes. Anyone wishing to take advantage of these free COVID tests just needs to go to www.covidtest.gov. And with that, I'll turn it over to Neil Rufino.
Good afternoon. Neil Rufino, Assistant Director for Parks, Recreation, Neighborhood Services Department. I'm here to provide an update on food distribution and childcare. Food distribution continues to be a needed service to our most vulnerable. While we have reduced food distribution from the same time last year, we still see a significant community need, with an average of 9.4 million meals each month this past quarter. In November, we actually provided approximately 5.2 million meals. As directed by Council, we are amending agreements with our partners through June 30th, 2022, and are having our partners support the transition to sustainable programs. The city continues the conversation with the county on regional food insecurity and planning for beyond the end of this fiscal year. Next slide, please. Regarding childcare, Omicron continues to impact our programs, with now 7 of our recreation preschool classrooms have been quarantined this past quarter. 92 ROC participants have been impacted and quarantined as well. We will be releasing a focused tutoring RFP to qualify best agencies to provide more education services across our 25 PRNS after-school sites. We have 106 participants enrolled in the second cohort of the library's Families, Friend, and Neighbor Caregiver Support Network. That's an 80% increase. This program also won a Top Innovator Award from the Urban Library Council. So far, over 1,000 students have received scholarship support for our after-school and preschool programs through $1.2 million support from the CDBG program. Now I will turn this over to Jill Bourne, our city librarian.
Thank you, Neil, and good afternoon, council members. I'm Jill Bourne, city librarian and director of the Digital Equity Priority Team. During this period, we have seen significant progress on all community Wi-Fi network projects. And the next project that will be coming forward for approval will be the Oak Grove attendance area in a few weeks. We currently have more than 8,700 hotspots and computing devices in circulation to residents, either through our school partners, partner organizations, and our libraries citywide. And while digital literacy classes continue through libraries and other partner organizations, we have also launched on-site and virtual tech support in Spanish and Vietnamese, at 3 branches. Now, one of our biggest drivers in how we are approaching these efforts in the current year is the evolution of distance learning regulations that our school partners and families are adapting to, which are leading us to shift more of our hotspot distribution to be managed through the libraries, which both allows schools to work with us to refer families as their individual household in-person learning status may change, allows families to pursue a hotspot at any time. It has less impact on school staff and allows for more effective device management of this collection. And then lastly, we have very good news. We were notified on January 10th that the city will be awarded a $3.6 million award through the Emergency Connectivity Fund. This funding will allow us to ensure that all hotspots are continued for another year. It helps us fully fund the Oak Grove Community Wi-Fi project. And I want to acknowledge the hard work of the digital equity lead, Ann Grabowski, and the library's IT manager, Hap Yielding, for the work put into a successful ECF application. And then I will turn it over to Jackie.
Good afternoon. I'm Jackie Morales-Ferrand, and I am the director of the Housing Department overseeing the isolation and quarantine team. What we have seen over the past few months is an increase in our unhoused residents needing a safe place to isolate as a result of this last surge. During the previous surge, the county leased 4 hotels for isolation and quarantine. 3 of those hotels were closed due to the lack of demand for the sites. But because of the Omicron variant, this has resulted in a need for more hotels for isolation and quarantine. The county is currently focusing its efforts on infection prevention measures in congregate shelter settings, and they also work to rapidly place infected and exposed individuals in separate hotel housing. This has helped to reduce the impact on our unhoused population. The county also has a better understanding of how quickly COVID transmits through their case investigation and contact tracing efforts. Housed people prefer to stay at home and be linked to resources such as financial assistance, food and supplies, and rental assistance. The county provides these resources to San Jose residents and also connects them to the rent relief program in partnership with the city to provide longer-term assistance. In terms of what's new, the county has increased their capacity from 1 hotel to 3 and now has a total capacity of 201 rooms. While many hotel owners were enthusiastic in partnering with the county for their vulnerable motel program, which was their room key, they're not as interested in leasing their hotels for isolation and quarantine purposes. As a result, these hotels are located in the county, none are in the city of San Jose. The county provides transportation via a cab company for those who do not have access to transportation or who do not prefer to drive. As a result, there are very few instances where a San Jose resident will refuse hotel support. In these cases, the county offers other resources so they can isolate safely. And with that, I am done and turning it back over to the team.
Thank you, Jackie, for that report, and thank you for the entire Emergency Operations Center team, the city staff, nonprofit and community partners who actually made all of that work happen. This concludes our update on the city's COVID-19 response, and I'm handing it back to our city manager, Jennifer Maguire, for any concluding comments.
I just want to thank the team, and it's back to the mayor. Thank you.